Now we get to look at two surgeries or two procedures, and these procedures are basically used in repairing all those spinal cord, spinal issues, right? We're talking about the cord is a nerve bundle, but spine is just bones outside. So we have the posterior spinal fusion for scoliosis. They also have the Hibbs spinal fusion. So this one is mainly for loss of normal curvature of the spine. You understand? So you are having these two coming in. So respectively, we are looking at the posterior spinal fusion for scoliosis, and next we'll look at the Hibbs spinal fusion technique. Okay, so you can see all of this around the spine. Okay. Scoliosis, your spine is making an S curvature. So they are trying to realign it so that it's relatively in the middle. So all of them, you should know that what their approaches in the history of spine fractures. You understand? So the posterior spinal fusion for scoliosis is a procedure where the vertebrae are fused together from the back to correct your spine from making this S curvature. Do you understand? I'm trying to make it that the spine is relatively, how it should be. So when scoliosis, you have scoliosis, you use this posterior spinal procedure fusion for scoliosis, all right? So technique, you expose the spine from the posterior side. I have to open the patient up. Then you place the bone graft along the vertebrae. So after you place the graft is when you now use all those rods, screws, and hooks to now put it in place. So steel rods help to support the fusion of the vertebrae. See, these are the grafts. Bone grafts are placed to grow into the bone and fuse the vertebrae. Okay. So goal is to stop the curve progression and achieve spinal balance and improve how the person is looking. That's the cosmetic aspect. Alright. So Hibbs spinal fusion technique. It was developed by Sir Russell A. Hibbs. I've spoken about his biography here. So it was one of the earliest systematic spinal fusion techniques. It was introduced in the early 20th centuries. Technique is a posterior approach to the spine. See. Oh, I brought only one picture for this. Alright, still fine. See? So there's removal of the posterior elements, could be laminae, spinous processes. We now place bone graft across multiple vertebrae so that it can achieve fusion. So it's mostly used for tuberculosis of the spine to stabilize the spine and prevent deformity. It can also be used for scoliosis and other spinal deformities. Alright, so that's it for these two surgeries.